chronic and toxic shame is crippling. It's paralyzing. It means people are not able to fully be themselves. So the focus of shame can be the mind in terms of intelligence, learning difficulty, neurodivergence, literacy, mental health, etc. But it can also be focused on the body, and this leads very much to sex and sexuality, where again there may be shame about how the body looks, the physique, the size, the skin color, things like body shape and how appropriate that is, especially within some kind of gendered ideal. But here are examples of the kind of shame a person might feel. Now, the second circle on the right-hand side is what I would give to a client. And what you can do here is you can say, this is an exercise, you can say, so these are some of the areas that people feel shame. And I wonder what you would put into here. Do you feel shame in any of these? The second one is attack self. Now here, the attack self is rather than hiding away, you then start to think about yourself even more negatively. So again, becoming very submissive, very compliant, very approval seeking because you think you're so bad, you always need to have approval. But it also is linked to something which we call self-deprecation. And then the other thing is that they may, need to protect themselves by just staying away from other people, and then they feel very lonely and withdrawn, and that causes even more problems. So some clients might bring detailed sexual experiences and descriptions, or things that are considered to be taboo, in order to embarrass or to shame or elicit shame in the therapist. De-shame the toxic shame and uncover the feelings, the emotions behind that. Look and identify the impact of shame. How does it prevent them from living fully and authentically?
Because this is something that this is a question that I sometimes I have with my clients, right? Is it worth to orient the patients who have a lot of shame, and maybe that is deriving from their family of origin, or because they were abused and so on, to explicitly give back the responsibility to the perpetrator or to the family or to someone.
So they just don't have access to the skills, to the knowledge, to a sense of, what is right for them and, their unmet needs. And in the absence, so the language I would use there, they haven't been properly resourced. And when you're not properly resourced, then it's very difficult to make optimal decisions.
And so on. So I guess that in those cases we would need to work in discriminating the shame that is imposed or the shame that is their own, right?
Yeah, no, absolutely. So let's go to that example, because that's specifically that's a really good example. The way forward is just to have knowledge and to be able to use it with our clients, and it's all about passing on, isn't it? Because they will pass that on in some way in how they behave and relate to others.